Hi guys, I am Tukai Chakraborty, your clinical nursing guide. Today I am going to talk about high risk medication administration and its policy. So high risk medication, or the medication which is having higher risk of causing patient harm, even death also, if it is used incorrectly or misused. So there are many types of high risk medication, but how to remember all the medication? Don't worry, for that there is a easy technique to remember all the high risk medication, that is APINCH. APINCH. A stands for any kind of antimicrobial drugs and antiarrhythmic medication. Antimicrobial drugs like amphotericin, vancomycin, tobramycin, this kind of medication, and antiarrhythmic such as adrenaline, atropine, and adenosine, and any other inotropic medication. These all are high alert medication. Next come to P. P stands for potassium chloride. Potassium chloride, not only potassium chloride but also any other high concentrated electrolyte like calcium, then magnesium sulfate, and NH3%. These are the medication which are also high alert, high risk medication. Then I stands for insulin. Insulin and any other anti-diabetic medication. So these are the high risk medication. And then N stands for narcotic and sedatives and muscle relaxant medication like fentanyl, morphine, oxycodone, and midazolam. Muscle relaxant like succinylcholine, propofol. These are the kinds of high risk medication. Then C stands for chemotherapeutic medication such as methotrexate, cyclophosphamide. These are the chemotherapeutic medication which is having cytotoxic action. Then the medication like heparin, H stands for heparin, warfarin, and enoxaparin. These are the kinds of anticoagulants, and like some anticoagulants or blood thinners in tablet form like ecosprin, Propitok. These are the medication which is having the high risk to cause adverse reaction or can cause some death also in some cases if it is used incorrectly. So let us discuss about how to take precaution while handling the high risk medication. First of all, you have to check. Three checking you have to do while handling with high risk medication, like after getting medication from pharmacy, then during the dilution or before preparing the medication, then before administering the medication. And you have to follow all the at least five rights of medication administration, such as right patient, right dose, right group, right drug, right route, all these things. Then you have to label it properly. While you are administering high risk medication, you have to label it with red ink or red color. Then you have to take counter sign of your senior nurse or any other nursing personnel while you are doing handling with high risk medication. Then if you want to store the medication, how you are going to store the medication? You should not mix it with general medication. Okay. Then if you are keep it in cascade, you have to always use lock and key and always label with red ink. Okay. And you have to monitor the patient after administering high risk medication. And before giving the medication, you have to assess the patient condition, such as if you want to administer insulin, you have to check HGT, that means patient sugar level. Okay. And you have to do accordingly. Okay. Thank you. And to get more video like this, follow my YouTube channel, your clinical nursing guide. Okay.